Welcome to The Explainer. So today, we're diving into some wild research that is honestly going to completely change how you look at your next dental appointment. I mean, I always just thought of the dentist as the place you go to, avoid getting cavities. But as it turns out, that chair is actually the brand new front line for your metabolic health. We're going to explore this totally fascinating hidden gateway between your gums and your entire systemic health.
Okay, so let's jump right into this. Can your dentist really spot diabetes before your primary care doctor even has a clue? The answer is an absolute yes. We're looking at some groundbreaking 2025 research that confirms the markers floating around in your saliva and gum fluid actually directly correlate with your blood glucose levels. It's crazy. Researchers are already building diagnostic models to screen for prediabetes and diabetes just by looking at that fluid in your mouth. Basically, your oral health is like this real-time metabolic dashboard.
And hey, we are definitely not just talking about some small, isolated study here. Check this out. Over 300,000 participants. A massive March 2026 meta-analysis in The Lancet Public Health looked at 28 longitudinal studies across 16 different countries. They screened all these folks and absolutely nailed down this bidirectional link between diabetes and oral diseases, things like periodontitis, tooth decay, and tooth loss. This connection is global, it's undeniable, and honestly, the sheer scale of this data is a massive wake-up call for modern medicine.
Let's move on to Section 2, Gums, the inflammatory gateway.
Now, our mouths normally host hundreds of totally harmless bacterial species that just form this nice healthy barrier. But I want you to meet the main culprit when things go south, P. gingivalis. This is a sneaky little bug that absolutely loves those low-oxygen pockets deep down between your gums and your teeth. When your gums get inflamed and ulcerated, they actually stop acting like a protective cuff. Instead, they act like an open wound. So every single time you chew, this wound leaks P. gingivalis and its toxic byproducts, specifically a highly inflammatory molecule called LPS and these nasty tissue-destroying enzymes called gingerpans, straight into your bloodstream.
And that leak triggers what scientists call the cytokine spillover mechanism. Here's how it plays out. First, the bacteria infect your gum tissue. Second, your immune cells rush to the scene and release these pro-inflammatory cytokines, which are basically like systemic alarm bells trying to fight off the infection. Third, because your gums have so many blood vessels, those inflammatory alarm bells literally spill over into your main blood circulation. And finally, once they're in your blood, these cytokines actively block your cell's ability to respond to insulin, which drives insulin resistance. So just like that, a localized gum infection becomes a whole body metabolic crisis. Metabolic scientist Ben Bikman actually uses a really brilliant analogy to explain this part. He points out that the LPS molecule from this bacteria interacts with these things on our cells called toll-like receptors. You can think of them literally like toll booths on a highway. When the bacterial LPS pulls up and binds to these toll booths, it does something really insidious. It blunts your immediate acute immune response, but at the exact same time, it triggers a chronic, low-grade systemic inflammation. It's not this huge, blazing fire. It's a smoldering, slow-burning fire that just quietly ruins your metabolic health over time.
All right, Section 3, Diabetes, the vicious cycle. And as you'll see, this destructive relationship actually goes both ways. Just look at how this cycle works. Diabetes creates a completely disastrous environment for your mouth. High blood sugar actually reduces your saliva flow, which leaves you with dry mouth and speeds up tooth decay. Plus, diabetic immune dysfunction means your gum infections heal way slower. And on top of that, elevated sugars create these things called advanced glycation end products, or AGS, which literally stiffen and damage the collagen right there in your gums. But then, in return, untreated gum disease drives that systemic inflammation we just talked about, which actively raises your HbA1c, your average blood sugar level. It's just a vicious, self-perpetuating loop.
Now, if that inflammatory cytokine spillover wasn't bad enough, these bacteria have a second, even more direct weapon. Remember those enzymes I mentioned called gingerpans? Well, once they enter your bloodstream and reach organs like your liver and your skeletal muscle, these protein-eroding enzymes physically chew up and degrade the insulin receptors right on your cells. They are literally destroying your body's cellular hardware, completely knocking out your cell's physical ability to bind to and respond to insulin. It's wild.
But here is where the clinical intervention data gets super fascinating. Multiple randomized controlled trials, including this massive gold standard Cochrane review of over 3,000 individuals, show that simply treating the gum disease, like getting beneath the gum line and cleaning out those bacterial pockets, can drop a patient's HbA1c by up to 0.4%. That is a huge metabolic win.
To put that into perspective for you, dropping your HbA1c by 0.4% is clinically equivalent to the effect of adding a second expensive diabetes medication, except here you get all the benefits with absolutely none of the side effects.
Which brings us to Section 4, a heart disease twist. Because yeah, this destruction goes way beyond just blood sugar.
The journey from your mouth to your heart is terrifyingly direct. In fact, the American Heart Association has been strongly warning about this exact link. Researchers have actually found these specific oral bacteria sitting right inside the atherosclerotic plaques of patients' arteries. First, the bacteria enter the bloodstream. Next, their toxic LPS activates these sticky adhesion molecules right on the inner lining of your blood vessels. That stickiness acts like a magnet, recruiting immune cells to the arterial wall. Those immune cells burrow in, and then macrophages start gobbling up oxidized LDL, what we usually call the bad cholesterol. They swell up into what are called foam cells, and that is what ultimately forms the plaque.
But wait, this brings us to an absolutely mind-blowing twist in how we actually view heart disease. I was genuinely shocked by this. The conventional view has always told us that LDL cholesterol is the ultimate villain, infiltrating the vessel wall and driving all this plaque formation, right? But researchers are now proposing a really compelling alternative view. It turns out LDL cholesterol actually has this unique biological ability to bind to and neutralize the toxic LPS coming from those oral bacteria. Meaning LDL might not just be some pathological bad guy, it could actually be an immune system tool deploying to the site of the infection to contain the damage. Think of it kind of like a fire truck at a burning home. If you had no idea how fires worked, and you just constantly saw a big red truck parked outside every single burning building, you might mistakenly conclude that the truck was actually causing the fires. Blaming LDL cholesterol for plaque formation just because it's at the scene of the arterial damage might be exactly like blaming that fire truck. The LDL might just be there trying to put out the inflammatory fire that was sparked by the bacterial leak from your gums.
Moving on to Section 5, Dentists, the new front line. Let's talk about how the medical system is finally waking up to all of this.
For years, there's been this huge gap between dentistry and traditional siloed medicine. Endocrinologists manage the blood sugar, dentists manage the teeth, and the connection between the two just falls straight through the cracks. But now, the American Dental Association has introduced specific codes that actually allow dentists to run chairside, point-of-service, blood glucose, and HbA1c tests. Just a simple finger prick right there in the dental office. Now, they aren't diagnosing you with diabetes, but they are assessing your risk right on the spot. Because if your blood sugar is dangerously low, they can't operate. And if it's over 300, they're going to delay any elective surgery because they know your mouth simply won't heal and you'd be at a massive risk for a severe infection.
And honestly, we desperately need these screenings. Just look at this recent pilot trial out of the UK from the University of Birmingham called the Indicate trial. They tested 805 dental patients who all completely believed they were perfectly healthy. The result? A staggering 15% of these quote-unquote healthy patients exceeded the thresholds for either prediabetes or full-blown diabetes, and they had absolutely no idea until they sat down in the dentist chair.
Because of how eye-opening that was, there's now a massive new initiative called Indicate 2. They're scaling this program up to 50 practices across England and Scotland, planning to screen over 10,000 patients. It's estimated that there are 1 million undiagnosed diabetics in the UK alone. So building out this care pathway means that your local high street dentists are literally about to become the most critical safety net for catching metabolic disease long before it ruins lives.
Finally, Section 6, Protecting Your Metabolic Health. Let's talk about what you can actually do.
So what exactly should we do with all this information? Well, here are the non-negotiable steps you need to take to protect both your oral ecosystem and your metabolic machinery. Number 1, brush and floss daily. And not just for a pretty smile, but to physically reduce the bacterial load that could otherwise leak into your bloodstream. Number 2, see a dentist every 6 months. And please, if you have blood sugar issues, tell them. It completely changes how they need to treat you. Number 3, control your refined carbohydrate intake. Sugars and starches ferment right there in your mouth and directly feed these pathogenic bacteria. You gotta starve the bad bugs to protect your metabolism. And finally, if you have active gum disease, you need to treat it aggressively. Do not let that smoldering fire keep burning.
I want to leave you with this one last provocative thought. The next time you look in the mirror to brush your teeth, I want you to ask yourself, are my gums quietly working against my metabolism? It's really time we reframe how we think about oral hygiene. Flossing isn't just some annoying chore you do to keep your dentist off your back. It is literally a critical, daily defense for your cardiovascular and metabolic health. Thanks so much for joining me on this explainer. Stay curious, and seriously, go floss your teeth.